Hi, if you do not have the money to set up your own practice, how can you be successful after BDS? In today's video, we are going to talk about step by step how you can do that. I'm Dr. Satish Kumar, this guy is in dental. Our aim here is to help dentists succeed. So, the first step is knowing whether you like clinical dentistry or not. So, during internship and within 3 to 4 months after that, you have to first make up your mind. How do you do that? Is by doing a lot of procedures in your various postings during internship. Also, finding clinics where you can observe, learn the work and see a wide variety of procedures being done. We have already created 2 videos. One is how to select the ideal clinic for you to work as a dental associate, and second, how to search such clinics. Both these videos would be posted in the description below. Once you go through these wide variety of procedures, you will get a basic idea whether dentistry is for you or not. So if you have decided that you do not want to continue with clinical dentistry, then you can go into non-clinical options. There are various jobs available. We have created an entire video explaining it, and also at the end of that video we have shown how you can search those kind of jobs. Now these jobs include medical transcription, medical coding, pharmacovigilance and many more. Now what if after doing all these dental procedures you realize clinical dentistry is what you want to do, that's where your passion is. Then you come to the next step where you have to decide whether you want to specialize and do a specific set of procedures or you want to be a general dentist. If you want to do a specialization, then you have to see 2 things. Number 1, you have to crack your NEET MDS so that you get into a government college. The second part is getting into a clinical subject where after you graduate from your MDS, you get a lot of consulting. Whether you should do MDS or not, we have already made a video about it. Go and check that out. We'll be putting the link in the description also. Now why a government college? Because the stipend provided there is more than enough to take care of your regular expenses during those 3 years. Now why a clinical branch? So that soon as you finish your MDS, you can go and find consultation positions, so that you do not end up in the same situation as you are after your BDS. If you're liking the videos we keep on putting out here, please do not forget to hit the like button below. So now, if you do not get into a government college in a clinical subject within maybe 2 attempts of giving the NEET MDS, or you have realized that specialization is not what you want to do, then what's your option? Even after 1 or 2 attempts, you do not get into MDS, but you want to specialize. Do not lose hope. After your situation is financially stable, you can later on specialize, maybe by doing a fellowship or an MDS at a later date. For the first year after BDS, you need to be counterintuitive. That is, do not focus on the money. Find a clinic where you get to do a wide variety of cases, from root canal treatments to composites and extractions. Within that 1 year, your hand skills have to be upgraded to a level where you can manage patients independently. The reason is, after this 1 year, when you're absolutely confident and competent in your procedures, you can go and find jobs where you get a percentage for the work you do. That is clinics where they let you handle the whole practice, or you can work in trusts. That way, you end up increasing the income you earn. Now, once you reach this level, there are 2 ways you can go about it. Number 1, you can continue in this practice where your income keeps on increasing slowly and steadily. The second is you keep money aside and start saving to start your own practice. In today's day and age, it would cost you somewhere between 4 lakhs to 5 lakhs, not taking into account the property cost to set up your own practice. So within a year or 2, maybe you can set that money aside. There are some, however, who would enjoy continuing in a percentage based practice because they do not want the stress or the headache of managing the entire show. They only want to focus on their patients. So basically, it is these steps you need to follow. Number one, understand whether you want to do clinical dentistry or not. If it is non-clinical, focus on that. Number two, if it is clinical dentistry, then whether you want to specialize by doing an MDS or you want to stick to general dentistry. If you have decided it is general dentistry for you, then you need to first spend time in honing your skills and eventually get into a practice where you get a percentage for the work you do. I hope you enjoyed this video. For more such content, do not forget to subscribe. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed.